Thank you, Mr. Chairman. Ms. Larson, the Biden administration has issued a number of COVID-19 vaccine mandates. One of them compels Medicare and Medicaid providers, such as hospitals and medical practices, to in turn force their employees to get vaccinated or risk losing their job. These mandates violate individual liberty. They violate the health care privacy of the employees. They're not authorized by law, and they could force people to receive a vaccine even if doing so is contrary to the medical advice of their own doctor. For the first 12 months of the pandemic, Republicans and Democrats together praised healthcare workers, praised doctors, nurses, physicians' assistants, technicians, pharmacists, other medical professionals for working tirelessly and despite personal risk for their own safety and health to treat Americans who contracted COVID-19. We all agreed that medical professionals were heroes. But for President Biden and for Senate Democrats, yesterday's heroes are today's government subjects who must submit. The message from Joe Biden and Senate Democrats is, do as the government says with your own health care or lose your job. Lose the ability to make a living. Lose the opportunity to provide for your family. That's the Biden administration's unlawful vaccine mandate. It is ironic that Senate Democrats are holding a hearing today about access to care, even though they're perfectly willing to let President Biden impose a policy that will cause medical professionals to lose their jobs and in turn diminish America's access to care. Ms. Larson, what are you hearing from medical professionals about their intention to submit to this mandate, and are there medical professionals who are not going to comply with this government mandate?
What I'd like to speak to is the application of telemedicine within this. So what I do hear from individuals are, because we are reaching patients across thousands of miles away, and it's the same clinicians, physicians, nurses, pharmacists, will we be requiring, the question is, what are we doing? And, we will be in compliance with what our customers in this case want. So in some cases, a receiving facility of telemedicine is saying all clinicians who are accepted on the medical staff need to be in compliance. And so it's interesting in that situation. We have to, be careful that we aren't subduing care or taking care away from them by not being compliant with the bylaws of the medical staff. And individual physicians will be taken off medical staff if they aren't compliant with the requirements. So right now, we're hearing a mix. There's, just like the nation, there's a mix of who is doing, who wants to provide care or who wants to get a COVID vaccine and who doesn't. And we're in this situation of trying to be in compliance so that we aren't taking care away from any organization.
Dr. Ransone, do you know how many doctors, how many nurses, how many healthcare providers have been fired because of the Biden administration's vaccine mandate?
No, sir. I don't have any numbers as far as termination of employment. The American Academy of Family Physicians does support the vaccination of healthcare workers for
the mandatory vaccination, regardless of whether they want to or not?
We support what's best and safest for our patients, Senator.
Does that mean the mandatory vaccination, whether they want to or not, and whether their own doctor advises it or not?
I think in a healthcare environment, each office, each hospital should be able to make their own decision about what is safest for the patients that come into their building or interact with their staffs. And I support their freedom to make a decision on what how they want their building or system to operate.
So I agree with you. They should have that freedom, and they're not being given that freedom right now because the Biden administration is forcing them upon it. I'll read to you a headline from the New York Times this week. This week, on October 4th of this week, New York's largest healthcare provider fires 1,400 unvaccinated employees. It is astonishing after we spent a year celebrating the heroes of healthcare, that Joe Biden's solution is we are going to use government power to force you to submit, and as a consequence, fire any doctor, fire any nurse who dares make a different decision. That is an abuse of government power. It is contrary to law, and it is bad policy for America.